I look at three things. I look at skin, laxity, stretch marks, excess skin. I look at fat, the distribution and amount, and I also look at muscle. If all three of those components have been damaged or changed through pregnancy or weight fluctuations, then I'll typically recommend a tummy tuck. If it's just fat, I might recommend just liposuction instead. And the first thing to talk about is where that skin laxity exists. So if a patient comes in with a lot of excess skin in the upper abdomen, above the belly button, as well as below the belly button, then I typically will recommend a full tummy tuck. Also, if a patient comes in with stretch marks all the way to above the belly button, my recommendation is typically a full tummy tuck so we can get rid of as many of those as possible. A mini tummy tuck essentially takes away, I would say, about half as much skin as a full tummy tuck. Tummy tuck is one of my favorite procedures because it is so rewarding. It's immediately rewarding, even though there's time for healing and recovery. They see that flat tummy the first time they come in a post-op visit. One interesting thing that a lot of my patients will come in and say, I work out all the time and I still have this bulge here, but I know I'm really strong. And I tell them, you can make those muscles really strong and you can make them thicker, but you can't pull them back together through exercise. That's where I come in surgically. A good candidate for a tummy tuck is someone who is of relatively normal and stable weight, someone who's not planning on having any more children, someone with realistic expectations about the surgery and what it can accomplish and understanding the scar, and someone who I think generally just has their life in order. Do it when you have the time, you have the resources, you have the help, and you have the time off of work. One of the more satisfying stories I have, and I've had a few of these patients who come in initially and we joke about keeping that scar low so they can wear a bikini, and they look me straight in the eye and say, I've never worn a bikini, I never will wear a bikini. And then when they come in at some point post-operatively, they tell me all about the bikini they wore up in Lake Tahoe. That's rewarding.